Hey y'all, welcome back to my channel. In today's discussion, we are going to be talking about do not become a phlebotomist if. Made it to the promised land, you guys. Welcome to my vlog. You wanna come with me real quick? So this is my place of peace, where I like to just go and wind down and breathe. I love it here. For some of you, phlebotomy, it may not be for you. It is what it is. If you are afraid of being exposed to pathogens, that's right, it's just a part of the job description. You're on the front lines. You will be exposed to blood that have contagious microorganisms. It's just a part of the job. So if you want to be a phlebotomist, you're going to have to accept that. You're going to have to accept perhaps maybe one day that will be a possibility of you contracting or being exposed to a contagious illness. That's why we practice safety. That's why safety is very important. And before you get hired at a job, your training on safety is like really crucial, and it's a long part of the process to get hired because you will be dealing with those specimens. You may be exposed to Ebola, COVID-19, TB. You'll be trained on safety in regards to drawing blood and making sure you are safe. That's why we wear our PPE, protective equipment. As a phlebotomist, bloodborne pathogens, exposures can happen while drawing blood and after drawing blood, meaning some companies will have you take your blood specimens straight to the lab and you process that blood, meaning you put that blood in different containers, you put the urine in different containers, and as you're doing so, specimens can splat on your face. That's why PPE is so important, and you'll be trained on it. As a phlebotomist, your job description is to draw blood from a patient. And how do you draw blood? You have to stick them with a needle. You got to poke them with a needle. You have to realize that you will be at risk of poking yourself. So that's why training is so crucial. Understanding and listening is so crucial during school. So make sure you are very, very careful. Needle stick injury. It is very important that you do not poke yourself. You will be learning safety tips and training at school. However, you are at risk if you are not careful, or if the person moves, if your patient moves or jerks or jumps, if you don't press down and anchor that vein like you're supposed to, if you don't have the strength. It's so many different things that come into play regarding needle stick injury, yet again, you are at risk. Rude patients. You will have all types of people sitting in your chair with, different beliefs and different manners. Can you take it? Are you able to stay professional during the times when patients can be mean and angry and just horrible? Next, stress. Whew. Can you work hard under pressure? Do you like a fast-paced environment? Well, it can be stressful sometimes. Rude and mean just because you have to deal with people with different religious beliefs and backgrounds, and even racist people. You have to deal with coworkers sometimes who aren't having such a swell day, or coworkers who think they're the supervisor. You have to deal with answering phone calls while tending to a patient, or inputting their information in. You have to deal with drawing patients' blood, and depending on how old they are, it can be, an infant or a child. They can, fight you or bite you or kick you, Getting poked isn't so friendly, right? Like, you're poking them with a needle and it hurts. So you're going to have to deal with that. And you're going to have to understand how to stay professional, be professional, and keep composure and just breathe. Just breathe. Because it will be tough. It will be stressful sometimes. You will have to work in a fast-paced environment. You will be timed also. Many companies time the draws. So you have to get them in and out. You got to make sure they are who they say they are, their name, their date of birth, the spelling of their name, their address, if it's correct. If it's not correct, their doctor, make sure it matches up. Make sure your requisition form is correct. If not, you'll get in trouble. And then you have to draw their blood in a certain amount of time. Many companies, they prefer under 10 minutes throughout the whole process. So I know sometimes patients want to talk to you and want to just get it all out, like you're their psychiatrist sometimes, which is okay. However, you will get in trouble if you're with that patient longer than a certain amount of time. And having them let all their problems out and just onto you, that's okay, because patient care, it's number one in the healthcare field. It's very important. It's very important that you have a positive attitude. It's very important if you can give them advice and make them feel good and feel better. I mean, they're getting poked, for God's sake, so it's like they're already stressed out. So if you can do that for them, that's like, it takes a lot of weight off of them. You never know how much of a blessing you can be with your positive attitude and your caring energy. You just never know. Like, I had this patient who I truly cared for. Like, she was so sweet. And after our conversation and seeing her like twice when she got her blood drawn, she went out of her way. She called my supervisor, my regional supervisor, told her about me, and then asked her if she could give me a raise or do something special for me. And she did. You just never know. You never know. So patient care is like number one. You'll make their day. And then it's a rewarding feeling that you made their day after they had a crappy day. You just never know who you're dealing with. Also, keep in mind that you will be dealing with patients who may be on their deathbed, who may not be, have a long life, and you may get attached to them, and they may pass away. And you'll have multiple patients like that in the field. Are you able to deal with that or handle that? It's a numerous, long list of stress in the medical field, but I promise you it's very, very rewarding. Investing in yourself. Education for phlebotomy is not free. You're going to have to pay a fee to go to school to become a phlebotomist. So after you complete your GED, because the requirements is you have a GED or a diploma from high school. After that, you can apply to become a phlebotomist. Training is about 2 to 3 months depending on your school. It's very short. To become a phlebotomist, I had to save up $2,700 or $2,500 for my school. Then there's hidden fees. You'll have to pay for your CPT testing, your national testing, so you'll be a licensed phlebotomist worldwide, like nationally certified. You have to pay for that. That's about $100 to $200 depending on your school, wherever you go. You'll also have to pay for, depending if you have insurance, your drug testing, your blood tests to see if you have any contagious illnesses. There's like little hidden fees that you don't know about. You also have to pay, unless it's inclusive with your school, you have to pay your fee for your books, your You have to invest in scrubs because some schools won't give you scrubs. And my school did not offer financial aid in regarding phlebotomy. So you have to save and invest in your future. Next, if you have a phobia, like a phobia of any bodily fluids, like a cut, a bruise, blood, if you faint, if you see blood, this field is not for you at all, because you'll be dealing with, you'll see a lot. You'll see people faint. You'll just see a lot, and then you're drawing their blood. So you're going to see blood. Blood can sometimes pop out of the needle. You know, you'll see a little circle of blood that comes out of the needle sometimes. You'll be processing blood. You'll have to remove some blood through a pipette and place it into other tubes. You'll have to deal with urine. You'll have to deal. Also, if you have a phobia of blood, like if you faint from seeing blood, or if you faint, like if you, I don't know what to tell you. I do know what to tell you. This is not the field for you. I'm sorry, but it's the truth, because you'll be seeing a lot of blood. You'll be processing a lot of blood. You'll even be processing other bodily fluids. So it can be urine. It can be saliva. It can be menstrual cycle urine. It can be poop, bloody poop. It can be parasites that you see in poop. Like, you'll be seeing that and you'll be processing it. So I don't know if this is the right field for you. If you can handle it, good for you. You'll also be seeing patients if you work in a hospital, or it can be in a regular lab. You can see a person faint. You can see a person die. You can see, like, are you able to take that? Do you know what to do when that happens? If a patient faints on you, are you able to proceed by calling 911, or proceed by the procedures of your lab, what to do in that instant? Or will you just freeze up or freak out? Are you able to psychologically handle that situation? Are you able to take that home with you? Will you treat people differently or treat yourself differently if you constantly see people faint or people die? Something to think about. Next, the pay. Being a phlebotomist, you may be overworked and underpaid. I've talked to many phlebotomists, conducted like many surveys, okay, in regarding the pay, even through YouTube. Even my coworkers, my previous coworkers, I've seen anywhere from making $16 an hour phlebotomist to $30 an hour to $35 an hour. It just depends on your state, your company. It depends how hard you work. Like, it just depends. So many phlebotomists are struggling. Is this something you would consider? You starting out at the minimum pay, $16, $17 an hour. I think Amazon pays more. Me personally, I'm single, so I'm a single parent. I just want to move up in rank. Being a phlebotomist, it's a rewarding career field. It is fulfilling, rewarding. It gives me so much knowledge in the medical field. And I just want to move up in rank in the medical field. I personally don't believe phlebotomy I can survive off of the salary in California. However, that's why I'm going back to school to become an RN or a CLS. We'll see. We'll see what happens. It pays well, but I'm just extra. So, you know, I gotta be making like 70 and up an hour. No, I personally really want a more challenging career. I want to help diagnose that patient. I want to be that scientist. You know, I want it all. Like, I want to climb the ladder. I want my own lab one day. I just want it all. So I'm not gonna stop, if that makes sense. I think being a phlebotomist is a great start for those who want to be in the medical field. I really do. Because I've heard so many horror stories of RNs, they need help regarding phlebotomy skills. No shade, but I think it's a good stepping stone. It also makes your resume better in regarding moving up in the medical field. Give you a lot of experience in the laboratory. It's a whole long list of positives in regarding boosting that resume and having that experience. Thank you guys for watching my channel. It's been great. It's all love. Sorry if I offended anyone. I'm just speaking my truth and speaking the truth on my personal experience and others. Thanks for watching. Please subscribe. Peace and love. Do not become a phlebotomist if you can't handle the heat in the kitchen, baby. Kidding. It's seriously some things to think about if you really want a career in phlebotomy.